Hello friends, let us now learn some important points about gallstones. Gallstones, if you see, we have mainly two broad types of gallstones, which include cholesterol stones and we have mixed stones. So first, if you see in the cholesterol stones, so we will see first one-liners. The most common gallstone which is seen in the whole world is mixed stone. Most common gallstone which is seen in Asia, in Asians, it is pigment stone. Most common gallstone seen in United States is mixed stone. In the cholesterol stones, first the etiological features of stones. The causes of cholesterol stones are: one, genetic factors. In the genetic factors, they are most commonly seen in North Americans, Indians, Hispanics. These are the different races where we most commonly seen cholesterol stones. Obesity actually increases the secretion of cholesterol, thus resulting in increased cholesterol stones. Weight loss causes mobilization of tissue cholesterol, and here the tissue cholesterol will again reach the liver, and this tissue cholesterol gets converted to biliary cholesterol, and this biliary cholesterol increases. So it is different, but even in obesity there is presence of gallstones, and also weight loss is also associated with gallstones. Then if you see in females, estrogen will activate the lipoprotein lipase receptors, and this estrogen will activate the lipoprotein receptors, and this will increase the cholesterol uptake. And if you see, as age increases, the cholesterol stones will increase. And obviously, hypomotility is a cause of cholesterol stones. Because of hypomotility, the bile remains stasis in the gallbladder, and as a result, this will result in formation of sludge or supersaturated material. Then clofibrate therapy. Clofibrate therapy will increase the secretion of cholesterol in the bile. So these are the different causes. Then if you see, we also have primary biliary cirrhosis. Primary biliary cirrhosis, CYP7A1 gene, both these are associated with decreased bile acid secretion. Okay, and this MDR3 gene defect results in decreased phospholipid secretion is seen. So these are the different etiological features of cholesterol stone. Then if you see the etiology of pigment stones, in the pigment stones we have, it can be due to genetic or demographic. These pigment stones are most commonly seen in Asia. It occurs in cirrhosis of liver, hemolysis, pernicious anemia, cystic fibrosis, parasitic infection, and in conditions like ileal resection or ileal disease or ileal bypass, we can see these cholesterol stones. These pigment stones. We can see pigment stones in all these conditions. So, as I have already said, gallstones can be divided into two types. One, we have cholesterol stones. Second, we have pigment stones. Cholesterol stones are most common and they are seen in more than 80% of patients, whereas pigment stones are seen in less than 20% of individuals. Cholesterol stone, 50%, it is composed of cholesterol monohydrate with calcium salts, bile pigments and proteins, whereas pigment stones are seen in less than 20% of patients and this contains calcium bilirubinate, which is the major component of pigment stones, and it is combined with less than 20% of cholesterol. So these are the different formulations of gallstones. So thank you guys for watching my lectures. In the next class we will learn about the pathogenesis of gallstones. Thank you for watching my lecture. Thank you.